Welcome back, everyone. Imagine you find yourself forgetting what you've just done, or maybe a conversation you had recently. Then you misplace objects, shoes in the cabinet, keys in the refrigerator. Well, that is the unfortunate reality seniors living with Alzheimer's face daily. I recently spoke with a medical specialist to learn more. Doctor, thank you so much for being here. Let's start first and foremost into how is Alzheimer's disease diagnosed?
Well, first of all, thank you for having me. So Alzheimer's disease is a diagnosis that we have to look at multiple different things. So we look at your history. We look at laboratories, blood tests, because we're looking for multiple different things. We also may get a scan of your brain and give you a memory test in the office that is fairly short.
And then what are some of the early signs and symptoms? So let's say, forgetfulness, I'm 53 and I have that right now. When should somebody be concerned about themselves or a family member?
Right. So when you should be concerned is when you see someone having troubles with things that they would typically do on a regular basis quite easily. So making a grocery list and being able to get your groceries, being able to drive your car to a known place, handling your finances. Those are things that perhaps are early and you should look out for as warning signs.
And then let's talk about how it actually progresses. What are some of those stages and how do we make sure that we're aware of those?
Typically, Alzheimer's disease has a slow progression. It's like being on a slope and going downhill. You can go through many stages. Initially, it might be very basic, some short-term memory loss, difficulties with handling finances, and then it can progress to not being able to dress properly, forgetting how to bathe, and then get more advanced where maybe you can't eat, you can't walk, you become bedbound.
I know, unfortunately, at this time, there's no known cure for Alzheimer's, but we have seen a lot of progress in slowing down the progression of the disease. Tell me more about that.
So yes, unfortunately, no cure. We do have certain medications, donepezil, memantine being two that you may have heard of, that can slow progression. That is our goal for those medications, to help keep you in a certain phase of the disease process for a lot longer before you get to a more advanced stage. We also will look at other things like reduction in alcohol intake if you are a drinker, look at your vitamin B12 levels, different things that may also help to slow progression.
You mentioned something early on talking about that you look at family history. So can Alzheimer's be passed down genetically?
Right. So there is a genetic component to Alzheimer's disease. Not all families will have that, but it can be seen in families where you'll note it in, say, a parent and then maybe a child or other people sporadically in the family. But it is not a guarantee that just because your mother had it that you would have Alzheimer's disease also.
Good, good. And let's talk about early diagnosis. I imagine if you catch it early, does that help then with the progression? It would seem like it would.
So yes, we like to have people come in when they first start noticing symptoms. Go ahead and let us check you out. The earlier that we can start working on modifying your risk factors, the better we are at slowing the progression and having you have a more normal aging process.
Now, will you tell me the difference between Alzheimer's and dementia? Because I remember later in my grandmother's life, she lived to be 93. My mom would say, well, now she has dementia. So where does that factor in? How are they related?
So dementia is an umbrella term for all the different types of cognitive disorders. Alzheimer's disease is one type of dementia. It is the most prevalent type. So umbrella term that we use to describe all cognitive diseases, Alzheimer's just being a specific one.
Okay, good. Thank you for clearing that up. And then, of course, we know that it is really a disease that impacts the entire family, caregivers. Let's talk about support quickly. What can we do to help our caregivers, help these individuals who are living with the disease?
Right. So when we're dealing with families that are caregivers for Alzheimer's patients, first and foremost, we want to tap into your other family members to provide you some support. Then there's also things like the Alzheimer's Disease Association that will have support groups that are online and also in person. There are community resources through different groups in the city that can provide assistance with caregiver resources, that can provide assistance with finding adult day centers or sometimes placement when you're unable to care for that patient at home. So there really are a lot of resources out there to help you as the caregiver while you are supporting your Alzheimer's patient.
Yes, thank you so much. Great information, and we so appreciate your time.
Thank you so much for having me.
Remember, if you're concerned about cognitive skills that you're observing in a family member or a friend or even yourself, just make sure that you head to a doctor's appointment and find out more. And of course, we'd like to thank Kaiser Permanente for sponsoring that segment.